Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mrs. Khalid. You look quite anxious. Is everything okay with you? Okay. Oh, I'm really sorry to hear about it, Mrs. Khalid, and I totally understand your situation and how painful it will be for you. But before I come to the management part, I'll ask you a few questions, okay, and we'll take a relevant history. Is it okay with you? Thanks for your cooperation, Mrs. Khalid. So can you tell me since how long ago did the dog bite you? Okay, 15 minutes ago. Okay, where were you when dog bit you? Okay, and where did he bite? Okay, was it a stray dog or a pet dog? Okay, a stray. Okay, was the bite provoked or unprovoked? Okay, where did the dog bite you exactly? Okay, if it bite you one side or multiple sides. Okay, and okay, Mrs. Khalid, so what measures did you take before coming in surgery so far? Okay. Okay, and do you have any circulation problem in your leg? Okay. If you are feeling any numbness, okay, feeling tired, anxious, if you have fever, okay, Mrs. Khalid, I'll ask you a few personal questions to better understand, okay, is it okay with you? Thanks for your cooperation, Mrs. Khalid. So, Mrs. Khalid, do you smoke? Okay. Do you have high blood pressure? High blood sugar? If you are taking any medication so far, prescribed by doctor or over the counter, or any immunosuppressant? Okay. Okay, Mrs. Khalid, are you vaccinated against rabies? Okay, Mrs. Khalid, if there is any possibility you could be pregnant, okay, okay, do you have children? Okay, may I know the age of youngest one? Okay, so if you had vaccination while pregnancy, tetanus vaccine, okay. All right, Mrs. Khalid. If you are allergic to any medication, okay. If you had any reaction previously in pregnancy while having a tetanus vaccine, okay. If you are allergic to eggs, okay, Mrs. Khalid. What is nature of your job? Okay, and how about your husband? What he do for living? Okay, and do you have any financial worries? Okay. Okay, Mrs. Khalid, is anybody accompanying you? All right. Okay. Okay, so Mrs. Khalid, I would like to examine you. Is it okay with you? Thanks for your cooperation, Mrs. Khalid. Then I'll apply gloves, and then I'll examine the skin, muscle if they are tender, and I'll check bone joint space, viscera if there are any bodies, and to know if any major resuscitation is required or not. Okay, and then I'll check distal neurovascular status, check pulses, and tender sheet involvement, bone injury, a particular vesicle in infants and in children. But as she is 35 years, so no need. And joint space violation. I'll check for any visceral injury, and if there is any foreign body. Thanks for your cooperation, Mrs. Khalid. Okay, I'm going to wash it. Okay, with soap. Okay, and water. Okay. Yes. Yes, Mrs. Khalid, I'm going to wash it with soap and water. Okay, and then with normal saline. Okay, 18 gauge needle. Okay, with high pressure to clean dirt and foreign bodies. Okay. Okay. So, Mrs. Khalid, in order to confirm a diagnosis and understand your condition more clearly, I would like to organize certain tests. Is it okay with you? Thanks for your cooperation, Mrs. Khalid. So I'm offering you to test your saliva, urine. Okay. Yes. And there is also a test, Negri body test, but it is required on 7th day. Okay. Is everything clear till now? Okay, now let's come to the management part. So Mrs. Khalid, I offer you post-exposure prophylaxis treatment, and it's very successful in preventing disease, and it helps to reduce the risk of getting rabies. Okay, and treatment of the exposure known as post-exposure prophylaxis. Okay, if administered promptly, generally within days of infection, then it reduces the chance of rabies. Okay, and Mrs. Khalid, I strongly recommend you to wash your wound with copious soap and water. Okay, put saline water from 20 cc syringe with 18 gauge needle with high pressure jet to clean all dirt and foreign bodies. Okay, and leave wound open. Okay, and as you had your primary tetanus vaccination completed, but did not receive any booster dose in last 5 years, so I'll give you a tetanus toxoid injection. I am in your buttock. Okay, is okay with you? Yes, Mrs. Khalid, but in your case it was unprovoked bite, and dog ran away after bite, and it's not traceable, so I'll consider the dog as possible rabbit dog. Okay, and give you anti-rabies immunoglobulins and anti-rabies vaccine right away. Okay, and will not wait for 10 days. Okay, is everything clear till now? Yes, Mrs. Khalid, I'll give you anti-rabies immunoglobulins. Okay, according to your weight. Okay, in your right deltoid muscle. Okay, intradermally. Okay, and then I'll start anti-rabies vaccine immediately, which will be given in the left deltoid muscle. I am. Okay. Okay. Yes, Mrs. Khalid, as you are exposed to possible rabbit dog and who was most probably never been vaccinated against rabies, so you should get 5 injections of rabies vaccine. Okay, and as you have presented in emergency department within 15 minutes after bite, so your wound is clean and no dirt, not much bleeding, and muscle tendons are intact, no bony injury. Okay, but as you stated that you are diabetic. Okay, and so your wound is high risk, so I offer you antibiotic containing amoxicillin and clavulanic acid. Okay, 625 mg. You have to take it twice a day. Okay, for 3 days. Okay. All right. Okay. So Mrs. Khalid, and then I'll see you after 2 days. Okay, on the 3rd day. Okay, and then I'll give you vaccine on 7th, 14th, and 28th day. Okay. And you'll need 1 booster dose at 19th day. Okay, is everything clear till now? All right. So, Mrs. Khalid, there is a safety netting that if you develop any of the symptoms like saliva drooling of the mouth, hypersalivation, fear of water, difficulty swallowing, difficulty in speech, you feel insomnia, headache, fever, anxiety, or confusion, or feel any discomfort, feel general weakness, partial paralysis, or feel any restlessness, agitation, or irritability, see hallucinations. So please seek immediate medical advice, okay? And I'm offering you some written material about dog bite to read at home as well, okay? Is everything clear till now? Okay, Mrs. Khalid, I'll see you after 3 days, okay? I wish you speedy recovery. Take good care of yourself. Bye-bye.